Hello and welcome. You're watching Coronavirus Facts versus Myths. I'm Rishika Barua. Amid the second surge of COVID-19 in India, today on the show, we focus on the current treatment strategies for COVID in India. India has seen its deadliest ever day since the beginning of the pandemic. Over 1,700 people have lost their lives to COVID-19 in just 24 hours. 2.59 lakh cases have been reported in this time period. India is also topping global COVID deaths in the last 24 hours. On the show today, we have expert voices from the United States and from here in India to make sense of the available COVID-19 treatments and to answer all your questions on COVID-19. What should you do if you contract the infection? When do you need a steroid? What are the current medications that are being prescribed to patients here in India? And more importantly, when should you be actually using those medications? We'll talk about all of that. I'd like to first introduce my first guest on the show today, Dr. Kritika Kupali. She's an expert in emerging infections and an assistant professor of medicine at the Medical University of South Carolina, joining us from the United States. Thanks so much. I want to ask you about treatment for severe COVID. What are the commonly used drugs and under what circumstances and at what juncture, more importantly, doctor, should these drugs be taken?
Sure. So one of the things that we recommend is, if possible, for someone to get a home oxygen probe or a pulse oximeter so they can monitor their oxygen saturation. If your oxygen saturation is greater than 92%, we recommend that you just continue what we call supportive care. So paracetamol for fevers and aches, hydration with water or other fluids until your symptoms resolve. Now, if your oxygen saturation falls less than 92%, this is when we recommend you seek hospital care. Obviously now with the situation as it is in India, this might be somewhat challenging. So if you have access to home oxygen, we want you to use the lowest amount of oxygen to keep your saturation greater than 92%. At this point, if you're using oxygen, this is when we would recommend using a medicine called dexamethasone. You would want to use 6 milligrams orally by day for 10 days. And then you want to keep monitoring your oxygen saturation and using paracetamol for fevers. I know that the use of remdesivir is something that people have been doing. I really would advise against using remdesivir unless you're under the supervision of a physician. And the data for remdesivir has not been shown to be helpful unless you need oxygen support. So if you have mild COVID, I would not recommend using remdesivir. It's really for the people who need oxygen support, who are getting sick, that we would recommend using remdesivir. And then for the other medication I mentioned, tocilizumab, that really is for people who are extremely sick in the intensive care unit. The data has gone back and forth with tocilizumab. There's some data that's come out of the UK in the recovery trial showing that if you use tocilizumab with dexamethasone in patients who are critically ill who've been admitted to the ICU, it can have some benefit. However, there are a lot of criteria that you must meet in order to get that medication. So again, I would not use that medication unless you're under the care of a doctor and in the hospital.
Well, I think that is extremely important advice, that you must only take these medications under prescription from a doctor or under medical supervision at a hospital, especially given the mad scramble for remdesivir here in India. I want to also ask you, Dr. Kritika, India has liberalized and opened up vaccination for all those above the age of 18 from the 1st of May. Is vaccine going to help in flattening India's COVID curve? How are you looking at India's second wave of COVID?
Sure. So I think that the fact that India has opened up the vaccination for everybody over the age of 18, I think that's wonderful, right? So it gives everybody access to this life-saving therapeutic, and I encourage everybody to get vaccinated who has the ability to get vaccinated. However, I do really want to stress that while vaccine is wonderful and it can prevent people from getting sick and it can prevent people from getting hospitalized and dying from COVID, it does not prevent the surge. You cannot vaccinate your way out of a surge. In order to flatten the curve, the things that are going to be very important are going to be adhering to these public health measures we've been talking about for the last year. So things like wearing your face mask and maintaining physical distance and adhering to good hand hygiene. Those things are going to be paramount. Avoiding crowds of people. So I know there are various religious festivals going on, and so it's going to be important to avoid those crowds of people and and maintaining yourself in places with good ventilation. So try and keep windows open, which I know especially can be hard as we enter the summer months when it gets very hot. But all those things are going to be really important to try and flatten the curve. The vaccine definitely is important to prevent other people from getting sick, but it's not going to help flatten the curve.
All right. Well, I think that's extremely crucial information. Dr. Kritika there, an infectious disease expert, saying that vaccination is key, but it's not going to immediately help to flatten the curve. Therefore, a whole host of public health measures are also needed. Let me open this up. We have Dr. C.S. Pramesh, Director of the Tata Memorial Hospital, joining us from Mumbai. We have Dr. Amrish Mittal, Chairman, Endocrinology and Diabetes, Max Healthcare with us. We have Dr. Avinash Bhonve, physician and former president of the IMA in Maharashtra. Thank you so much, doctors, for sparing your valuable time and being with us. I want to focus on talking about treatment for COVID. There is a lot of misinformation that's out there, a lot of mad scramble for drugs. People very confused about what they should do when they contract the infection. Dr. Pramesh, you've been writing about this extensively. What's your advice to patients when it comes to treating COVID-19?
Thank you. I think Dr. Kupali summarized the data very well, including the recommendations for treatment. I have very little to disagree with her, except that I would add proning, which means when you're lying down, you sleep in your with your chest down and your back up. So just this very simple act does improve saturation, and especially when in the crucial period between when your saturation goes down and before you're able to get a hospital bed. This maneuver does help, and it's a very simple maneuver which can be done at home and even after you get admitted to the hospital. It is very unfortunate that there is this mad scramble for several drugs. Families and relatives of patients admitted trying desperately to hunt for a drug which they think is the difference between life and death. It is useful in a few very select conditions, but for the vast majority for whom it's being prescribed, it's of virtually no use. And therefore, it's important to be very careful about selecting the patients who will benefit from these drugs.
Right. And Dr. Amrish Mittal, I want to bring you in here because when you're talking about treatment of COVID-19, I think, diabetes patients are known to be the most vulnerable. A lot of viewers have actually asked this question. How do you continue to treat diabetes while you're also COVID positive?
Yes, that's a question that's asked several times a day. We know that people with diabetes have associated comorbidities, not just diabetes. They often have high blood pressure, they have kidney disease, they have hypertension, and a constellation of all these actually increases the risk of poor outcomes. So it is very likely that when we first get COVID, if we have diabetes, the sugars might go up depending on the severity of COVID, because any infection will increase the sugar. So that's one part. So there is some increase in sugar, and therefore the medicines will have to be adjusted. You have to be in touch with your physician or diabetologist, endocrinologist, whatever. The second thing that happens is the use of steroids, which is obviously, they are very critical drugs in the treatment of COVID. And when there is a combination of severe infection plus steroid usage, the sugars go through the roof. They really go through the roof. And it requires often temporarily shifting to insulin. Therefore, it is important for us to realize that we must control our diabetes well during COVID, because that improves our outcomes. At the same time, It is not necessary to be obsessive about it, because when these drugs are used like steroids, the sugars will go very high.
Okay.
So you have to be in touch with your doctor, and if necessary, you may have to go on insulin for a short period.
Right.
Don't be scared of that.
Okay. I want to just bring back Dr. Pramesh, because Dr. Pramesh, you've been making a very important point, and you've been tweeting about, COVID treatment. You say that most patients don't reach a stage where they need steroids, and that most patients, can just be treated with regular paracetamol. I want to ask you, at what point do patients need to be given steroids?
So this is one of the areas where we have fairly good data on, and the recovery study trial showed this very, very nicely. So as long as you're not requiring oxygen to maintain your saturation, steroids don't really help. And in fact, there is a trend towards actually causing harm. So long as you don't require oxygen, you're good not using steroids. The steroids actually come in for moderate to severe COVID when you start requiring oxygen, or if you are actually getting ventilated. So those are the situations where steroids are actually beneficial.
Very, very, very important advice. Dr. Avinash, would you like to weigh in here? I want to ask you specifically about the use of steroids. So now, Dr. Pramesh has clarified that steroids only need to be used when your oxygen saturation dips. The most commonly used steroid is dexamethasone, if I understand that correctly. Can you tell us more about it?
Yeah. Right now, only one correction. There are if you classify the patients who come corona positive, if you see, there are right now 90% of patients are asymptomatic or having mild symptoms. So we have to do this thing. They can be treated at home with home isolation under a doctor's telemedical consultation. The second thing, if they have, we have to investigate them. There are certain markers which give this cytokine storm inside. If these values are very high and the oxygen is also going gradually down, then we have to start steroid. It is not that for each and every patient the steroid is started. There are certain guidelines, certain things, certain markers which go above, then you start these steroids. As long as along with that, there is also the blood thinners which we have to add. But all these things has to be done as per the evidence. Not only the patient says that it is worsening. Right now, one more thing, that usage of remdesivir as well as putting patient on oxygen at different rate are decided by the doctors as per the patient conditions and his evidence. Yeah.
All right. What about tocilizumab? Dr. Mittal, can you tell us a little more about this drug? We know that it's only used in very critical care patients. And the reason I'm talking about these drugs is because there is a mad scramble for these drugs. They're running in short supply, as many people believe that these are life-saving drugs that they must stock up as well, which is an absolute myth.
So I think the role of tocilizumab in managing COVID is very limited. And clearly, it's not even for public discussion, really. That's really not even in the regular physician's domain. It's the intensivist domain at that point who will decide this drug. It has multiple side effects. There are lots of issues with the drug, and it is used as a sort of in very severe and almost like a life-saving measure, but it's not necessarily a wonder drug or anything. So it's like, because we don't have any good antiviral drug for most diseases, including COVID-19, it's the absence of a good antiviral drug that spawns the usage of these other drugs in this situation.
All right. So, Dr. Pramesh, if I can ask you about two more drugs that a lot of viewers have questions on. One is Fabi Flu and one is Ivormectin. These are prescribed in India for the treatment of mild COVID. What do these drugs really do, and how crucial are they in managing COVID-19?
Right. So I'll start with favipiravir. There's virtually no evidence to suggest that it helps improve outcomes in mild COVID. It is something that is prescribed a lot, I know, but besides giving a placebo effect, it virtually has no benefit to patients.
Right.
Ivermectin has a little more data to it, but the only study that's been completed so far is a randomized trial, which did not have enough number of patients, but even that did not show a benefit. So if you were to ask me now whether there is benefit of either of these drugs in early COVID, the answer is no.
All right. So I think you've heard it from the expert doctors. These are drugs that everybody is talking about. Do not rely on information that you find on Google about these drugs. Listen to the experts. We're going to slip into a very short break at this moment. Our panel of expert doctors will continue to be live with us. As a number there flashing on your screens. Dial us. Ask your question and have them answered by the experts. Short break here. On the other side, we'll answer all your questions. Panel of expert doctors continues to be live with us. Our first caller, Geeta, is dialing in from Mumbai. Go ahead.
Hello, good afternoon to everybody, and I'm thankful to all the doctors for the nice advice they are giving for COVID treatment. I have one question. My son and daughter-in-law are in Boston, and they were suffering this beginning of this month from COVID-19. And I only want to know that my son, when he had more than 104 degree temperature for 5 days, nearly 5 to 6 days, and my daughter-in-law recovered within 5 days, and it started with a low temperature and it was climbing up at night most of the time.
Okay.
Can you please give me the cost for this kind of COVID attack? Thank you.
All right. Would any of the doctors want to take that on? Dr. Avinash, could you explain perhaps the trajectory of why this infection played out the way it did?
Yeah, actually, there is no evidence that coronavirus increases with the climate temperature. We have seen it increases even in the 50 degrees plus countries and also in the cold countries. It, of course, varies from area to area, but the climate and temperature has got no role. As far as the recovery of any patient is concerned, they are absolutely the individual variations. You cannot generalize this thing that some patient is recovered in 5 days and the other patients are not. So these are the things as per the patient's this thing. In India, we take 10 days as for the average recovery, and we even do not advise to do a COVID test after 10 days. After 10 days, you are declared as you are cured, unless the patient is very severe and having some other problems.
All right. I think that's very important information as well. We have Paul dialing in from Bengaluru. Go ahead.
Good afternoon, doctor. Doctor, this is regarding whether I should go for injection, COVID injection or not. I am taking medicine for rheumatoid arthritis and myositis. I'm taking steroid of small level of 0.5 mg, Azuran, and SPQS 200 mg. So I am having this medication for the last 15 years.
Okay.
So my clarification is that whether I can eligible to take the COVID injection.
Right. Dr. Pramesh, would you like to take that on?
I assume Mr. Paul is talking about the COVID vaccine.
Yes.
Yes, you should take the vaccine because none of the medications that you are in are actually contraindications. And to be fair, there are very few situations where you should not take a vaccine. So, for example, one of the conditions is after a bone marrow transplant, you delay it for 3 months after the transplant before you take it. But other than that, there are very, very few situations where we would advise you against taking the vaccine.
All right. Very important advice. Last caller, Prakash, dialing in from Hyderabad. Go ahead.
Hello. Yeah, sir. Actually, my question is, what are the chances of the person getting reinfected? Because I tested positive for COVID.
Very important question. Dr. Mithal, would you like to take that on? Chances of reinfection amid the second wave.
So while the numbers are not clear yet, the chances of reinfection are small, but we are all seeing cases who have got reinfection. We are all seeing cases who were proven COVID last year, had developed good antibody titers, and are now again falling prey to this COVID. So there are two possible reasons. Number one is that there is immunity that wanes over time, and these people after a few months again are prone to get infection. Second is that there may be a change in the strain or in mutations in the virus that make it escape the previous immune response. So this data is being generated, but quite clearly, if you've had COVID in the past, does not make you immune. Please make sure you wear your mask, double mask, keep distance. Don't give up those precautions because you've had COVID. You can get it again.
Well, that's very important clarification there coming in. I'm afraid that's all we have time for on the show today. Thank you so much, doctors, for sparing your valuable time and being with us on NDTV. Thank you all for joining us.